let's jump right in. When you think about healthcare, your brain probably goes straight to hospitals, doctors, or pharmacies, right? Life-saving medications. But behind all that clinical action is a massive, completely invisible physical network. Healthcare distributors are the vital link that buys, stores, and sells the actual physical products, moving them from manufacturers right to the front lines. We're talking about everything from basic saline drips to incredibly sensitive temperature-controlled vaccines. Today, in this explainer, we're diving into the hidden engine of this whole operation, fleet fuel management. So here's the big question. How does the healthcare industry actually measure the hidden cost of moving millions of medical supplies every single day? We're going to skip the formalities here because the sheer scale of this challenge is wild. Delivering consumer health products and life-saving devices doesn't happen by magic. It takes immense fleets of vehicles burning millions of liters of fuel, crisscrossing the planet 24/7. And managing the fuel for those fleets? Well, that's not just an operational headache. It's a massive financial and environmental variable that can completely flip a distributor's bottom line. To figure out exactly how companies are tracking all this, we're grounding our analysis in the official 2023-12 sustainability standard for the healthcare sector, specifically focusing on healthcare distributors. This framework comes from the ISSB, the International Sustainability Standards Board, and honestly, it's basically the gold standard. It lays out exactly which sustainability risks could realistically impact cash flows, financing, or the cost of capital over the short, medium, and long term. We're not just talking about abstract, feel-good environmental goals here. No, we are talking about hard, quantifiable financial risks that investors absolutely care about. Which brings us to Section 1, the invisible distribution network. If we zoom out and look at this invisible network from a macro level, we really have to consider the environment these companies operate in. Healthcare distributors are navigating an industry driven by insurance rates, shifting drug spending, and rapidly changing demographics. Because of all that, there's this intense, nonstop pressure across the whole sector to cut costs and boost efficiency. And guess what? A huge chunk of those costs lives right out there, on the road, up in the air, and out on the sea. The SASB standard actually calls out a primary threat here. Because healthcare distribution relies on what they term significant transportation networks, these companies face massive exposure. Specifically, the growing concerns over climate change and dwindling natural resources directly mess with fuel pricing. I mean, think about it. When you're running a fleet of thousands of vehicles, even a microscopic tick upward in the cost of fuel translates to massive financial swings for the entire business. That kind of volatility is a deep structural risk to the healthcare supply chain. And you know what's really fascinating about this tension? It creates an incredible high-stakes balancing act. On one side of the scale, you have the absolute necessity of the network. Human health literally depends on it. People need their medications, hospitals desperately need their equipment, the demand is constant, and it's critical. But on the other side, you've got the extreme volatility of fuel pricing and resource availability. Healthcare distributors are caught right in the middle. They can't just throw their hands up and stop delivering life-saving supplies or delay shipping vaccines just because diesel got a little too expensive this week. There's no way. They are forced to absorb or somehow mitigate those cost fluctuations, which puts an absolute premium on making sure every single drop of fuel is used as efficiently as possible. Moving on to Section 2, Tracking Payload Fuel Economy. Because this financial exposure is so incredibly high, the SASB standard doesn't just casually suggest that companies watch their fuel gauge. Oh no, it provides a highly specific, standardized formula for exactly how they need to measure and report this risk to investors. The standard lays out two core fleet fuel management metrics. The first one, HCDEI 110A1, is purely quantitative. It tracks payload fuel economy, and it's measured in liters per RTK. We're going to define what RTK actually means in a second, but basically, that's the hard math of the operation. Then, right below that, you have metric HCDEI 110A2, which is qualitative. This one's a discussion and analysis metric. It requires companies to give a comprehensive description of the actual efforts they're making to reduce the environmental impact of their logistics. So it's a clever two-step process. First, show us the raw, unfiltered data of how much fuel you're burning. And second, explicitly explain the strategic moves you're making to improve that exact number. Okay, let's deconstruct some of that complex accounting jargon from the first metric. What on earth is a liter per RTK? Well, RTK stands for revenue ton kilometers. You figure this out by taking the vehicle kilometers traveled on a specific leg of a journey, and you multiply that by the number of metric tons of revenue traffic, the payload, that's carried on that leg. This is an absolutely crucial distinction because it doesn't just measure how far a truck drove. It measures how efficiently that truck moved a specific weight of actual revenue-generating product over that distance. So to put that into perspective, it's not just about tracking a delivery truck driving 100 miles. It's about measuring the fuel efficiency of that truck moving exactly 2 tons of critical vaccines over those 100 miles. And that leads perfectly into how the standard meticulously defines payload for this equation. The standard is extremely strict here for a very good reason. Payload includes the total weight of the paid tonnage transported, but, and this is key, it explicitly and intentionally excludes the vehicle weight itself. Why does that matter so much? Because quite frankly, investors do not care how efficiently a company can drive an empty truck around a city. They want to know the fuel economy of moving the actual medical supplies that make money. By strictly kicking the vehicle's weight out of the math, this liters per RTK metric gives us a pure, unadulterated look at the true fuel efficiency of the product delivery itself. It cuts out all the noise and leaves you with the raw operational reality. Plus, a healthcare distributor can't just track their local delivery vans, report that number, and call it a day. No way. The standard requires the entity to aggregate its payload fuel economy comprehensively across all types of transportation used in its entire delivery fleet. This means it is mandatory to track air, marine, rail, and road transportation. You need this for a complete picture, right? Because a massive cargo plane climbing to 30,000 feet burns fuel very, very differently than a slow-moving freight train or a cargo ship. Tracking all modes is literally the only way to understand a company's total exposure. Oh, and by the way, this applies to vehicles the entity directly operates, like the ones they own or lease long-term. But the company also has to explicitly specify if any portion of its logistics operations is outsourced to third parties. They really have to cover the whole shebang. All right, Section 3, Strategies for Greener Logistics. So now that we've tackled the quantitative data and how companies measure the sheer scope of the problem, let's pivot to the qualitative analysis. This is where that second metric comes in, requiring companies to outline the nature, scope, and rollout of their programs to shrink their environmental footprint. The standard actually drops some exact real-world examples of what these actionable efforts should look like. For starters, we're talking fleet upgrades specifically aimed at fuel efficiency, like retiring those older gas-guzzling trucks in favor of newer, highly aerodynamic models. Then, you've got the adoption of alternative or renewable fuels to power these massive fleets, pulling away from traditional diesel. It also includes optimizing logistics routes, meaning they use advanced software to map out the absolute shortest possible paths, which can easily shave thousands of miles off a fleet's annual travel. And finally, idling reduction programs. This just makes sure that vehicles aren't sitting out back at a hospital loading dock burning precious fuel while folks are loading or unloading medical supplies. These are the concrete day-to-day operational steps distributors are taking to drive down that liters per RTK metric. And that brings us to Section 4, Creating Long-Term Value. So why does all this deeply operational, highly technical tracking of fuel management actually matter to the business's bottom line? Like, what's the so what here? Well, it's not just about ticking a compliance box. It is fundamentally about building a resilient company. In fact, this quote straight from the SASB standard might be the most impactful thesis statement of the entire framework. It says, entities that improve transportation efficiencies may be better positioned to create value over the long term. That perfectly captures why this data is so vital. In the healthcare distribution industry, sustainability and financial stability are completely intertwined. If a company can optimize its routes, upgrade its fleet, and actively dial back its fuel consumption, it is simultaneously reducing its financial exposure to wild fuel prices and lowering its environmental carbon footprint. Good environmental stewardship isn't just a nice-to-have secondary goal here, it literally becomes a direct, measurable competitive advantage. Which leaves us with this final, somewhat provocative thought. When we consider the immense, truly global scale of healthcare distributors, companies moving millions of pharmaceuticals, highly sensitive vaccines, and vital medical devices by air, sea, rail, and road, how could optimizing this invisible network not just save these companies a fortune, but fundamentally transform global healthcare delivery as we know it? By mastering fleet fuel management, these companies are ensuring that life-saving supplies reach patients more reliably, more affordably, and way more sustainably than ever before. Thanks for joining me on this explainer. I really hope this gives you a whole new perspective the next time you spot a medical supply truck creasing down the highway.